Hi, I'm Dr. Nikhil Shellagi. I'm a consultant surgical gastroenterologist and advanced laparoscopic surgeon working at Manipal Hospital Whitefield, Bangalore. So today we are going to discuss about hiatus hernia. So depending on the types of hiatus hernia, we classify them into sliding type and a paraesophageal type, where the sliding type portion is directly pushed up along the same opening, and the paraesophageal hernia is a portion of the stomach herniates just adjacent to the food pipe and then enters into the chest cavity. So depending on the symptoms and severity and chronic symptoms, we usually evaluate further to know the severity of the disease. So we would initially get the investigations done, the routine blood test, including the thyroid profile, to see if there's any hypothyroid or other factors causing things delaying in the motility. And then after the basic blood workup is done, then we would get the endoscopy done. Endoscopy is again basically to see the esophageal ulcers, esophagitis, where there's any redness in the esophagus, and how the aperture, that is the opening, the valve between the esophagus and food pipe. So if it is very lax, then that is another sign to say that the patient has got recurrent reflux symptoms. But a particular manner during endoscopy, we see that there's a presence of hernia. Again, it can be a very small hernia to a large hernia, depending on the symptoms and long-standing symptoms. So once this is done, we would further evaluate them by a CT scan. If they are too symptomatic, CT scan will again tell us the presence of hernia, the presence of stomach portion herniating into the chest cavity. And after this, if the hernia is small and symptoms are too significant or not atypical symptoms, we would further confirmation of diagnosis. We would get esophageal manometry and a 24 pH manometry. Esophageal manometry is something where they would put a scope into the food pipe and check the movements of the esophagus, whether there is any delay in the movements when they swallow, if there's any dysphagia. So that would again actually attribute to symptoms of reflux disease. If that is ruled out, then there is something called 24 pH manometry, where they would keep a probe in the esophagus and another probe in the stomach and monitor it for 24 hours. If there is significant acid reflux which is coming into the food pipe, then we would say that this which is not normal and this is definitely abnormal, and then we are justified in going ahead with treatment. So the treatment can be in the form of medical management and surgical management. Always the medical management is the initial line of treatment. And if the symptoms are improving, then we would always continue the medical management with modification in the lifestyle, like asking someone to lose weight if they're obese, and consuming high fiber diet, low fat diet, maintaining good gap between each meals, small frequent meals, and when they are lying down with at least 30-degree elevation, so that they are not lying flat and the reflux is less. So in spite of all this, if the symptoms are not reducing, and if we have documented that there is a significant acid reflux on the manometry and the endoscopy, then the best treatment would be a surgical correction. This is again, nowadays we perform the surgical correction by laparoscopic, that is a minimal invasive approach. The procedure is called laparoscopic hiatus hernia repair with a fundoplication. So the fundoplication is something where we are going to reduce the hernia, repair the aperture where the food pipe is coming down into the abdomen. So make it taut so that there is no herniation again after the surgery. And to prevent this and to augment the lower end of the sphincter, we would actually wrap the stomach around the lower end of the esophagus. So this would act as a new sphincter and prevent the reflux of the food material. So usually the patients are off medications 1 week post surgery, and the quality of life improves, and the complications of long-standing reflux disease subsides in a patient who had a long-standing reflux disease with hiatus hernia. So again, neglected reflux disease can in long term end up having a problems. One of the major complication is they would develop Barrett's esophagus. So this is something where the mucosa of the lower esophagus would change to a different layer, which is a pre-malignant condition, and long term they might end up developing a cancer. My advice is always the first line is the medical management. Apart from the medical management, it's the lifestyle modification. In spite of all this, if the symptoms are not subsiding and the severity worsens on the medical management, then the final treatment options would be surgical, again which it can be tackled laparoscopically, and the recovery is very quick, and 24 to 48 hours is the hospital stay, and they are back to and they can resume life, normal life in a week. Thank you.